Good morning, Aradhana.
Very good morning, ma'am.
Please, because yeah.
teams time from selection to team scholarship കിട്ടിയെന്നാണ് അറിയാൻ കഴിഞ്ഞത്. സോ ഇപ്പോൾ എല്ലാ രീതിയിലുള്ള പാർട്ടിസിപ്പേഷൻ സപ്പോർട്ട്
Sir, hello. Good morning, Amal Raj, sir. So, is this Amal Raj from ILDM? Sir,
Yes,
I hope I'm audible to you. Yes, sir. Good morning, sir.
good morning. It is audible. It's clear.
Yes.
Actually, the second speaker, Anu, is also with me right now.
Okay. Yes, sir.
So we would be presenting from the same place.
Okay.
We will actually, I will be present in somewhere else, and Anu sir will be presenting from some particular place. So we are here, and Naushab is also there. And sometimes she may demand your help for presenting the PPT. Sometimes.
Yes.
So if she demands, kindly support her. That's all.
Definitely. Thank you, sir.
Yeah.
Thank you.
Thank you.
Good morning, Amalji. Aradhna,
Yes, ma'am.
do you have a copy of the speaker's PPT in case she needs your help?
Yeah, at least I have for Anu, sir. Naushaba, ma'am. Yeah, I can guide her.
So yeah, so you can manage that, right? In case she needs that help.
Yes.
Okay, great. All right.
Miss Naushaba, am I audible to you?
Yes.
Ma'am, welcome to the webinar. Ma'am, since you're the panelist, ma'am, are you being able to see the icon below?
Okay.
Yes. Ma'am, there is a third icon called share.
Yes. But
Yeah, from there, ma'am, you can share your presentation.
but
Good morning, Naushaba ji.
good morning, ma'am.
What
Yes,
you do
yes.
is first have the PPT opened in your system.
Yes. It's already open. Okay.
Okay, so then it will be easier for you to view once you click on the share button.
Okay. I click
Then you
here.
can see.
Okay.
Yeah. Now it's opening. All right.
Is
It's showing that it is starting. The presentation is not visible yet.
wait.
Or if you're comfortable, you can share a copy with Aradhna so she can run it for you on from her system also, whatever suits you.
Okay, wait. I will try this first. Is that visible? Hello?
Ma'am, previously it was visible. I think the content is still loading.
Okay.
Ma'am, is it visible in your screen?
Yes, here it is visible.
Okay.
Then it's okay. You start from your side. The presentation you can.
Yes, ma'am, but of course, I need your presentation.
I already mailed to Amal sir. Could you please ask him?
I had shared it, I think. Do I share over email?
So WhatsApp, emails, anything, what?
Aradhana, I've just forwarded, Amal sir had forwarded Shaba ji's presentation. Check your mail.
Yes, ma'am. I've received it. Yes, ma'am.
Okay, great.
അടുത്ത ആപ്ലിക്കേഷൻ ഉപയോഗിച്ചുകൊണ്ടിരിക്കുകയായിരുന്നു. ലോഗിൻ ക്യാമറ വേറെ ആപ്പ് ഉപയോഗിക്കുക എന്ന് പറഞ്ഞു. Good morning, Sushma madam. Can you hear me?
Yes, sir. So you are visible. You are visible and audible as well.
Yeah, thank you.
Good morning, Anu sir. How have you been?
Yeah, fine.
All good? Smooth?
Smooth.
Great, sir. Aradhana, shall we start?
Yes, ma'am. Yes, ma'am.
I think the participants will join in.
Yes,
There'll be
ma'am.
more. All right.
Yes, ma'am.
So very warm good morning to all the participants who have joined us on behalf of the National Institute of Disaster Management, as well as our collaborator for this webinar, Institute of Land and Disaster Management, Government of Kerala. So I welcome on behalf of both these institutes to all the participants for, I think this is a very important area, and that is multi-hazard preparedness during the current pandemic situation, and an emphasis on the state of Kerala. As you all are aware, Kerala has been experiencing a couple of major disasters since the past few years, starting from the fury of August 2018 floods that it experienced, It saw a death of about I guess approximately 500 people losing their lives, and I think more than about 10 lakhs. A daunting task to shift them to safe sites and safe shelter zones. That required a lot of. It was a humongous task by the response agencies as well as the government of Kerala. Parallelly, in 2019 again, rainfalls have been occurring in 2020 with the entire world, most nations still struggling to deal and manage the pandemic situations. And Kerala, I think, was the first one which reported the first case of the coronavirus also. And, in between, it had kind of curtailed and, controlled the pandemic situation. And again, the rainfalls in the month of, I think, August, September sometimes, couple of landslides, not couple, actually a huge number of small minor landslides that have occurred parallelly. The pandemic still posing, the threat for the administration to manage and deal with it because it requires a lot of, as a preparatory measure or as a safety measure for distancing and, maintaining distances between people, and the other incidences or other disasters that have been occurring, they require people to be shifted, in large groups to safe shelter sites. So that's like a contrast, kind of management required, and that's a challenge. And then now, I think with the cyclone fury around, and earlier it used to be said that the east coast of India, sees more of cyclones, and mostly the state of Odisha, Andhra, and Telangana. Likewise, but even the Oki of 2017, that the state of Kerala experienced, is a kind of eye opener for all of us that the east and west coast are equally becoming vulnerable to heavy wind speeds and cyclonic activities and storms, and that requires for a lot of preparations. It calls for responses, nonetheless an important component, without which you cannot actually deal with such events, but the pre-events also. So a lot of now, I think, emphasis and measures need to be adopted by all these coastal states for better preparedness and management in terms of structural, non-structural mitigation aspects as well. So with these, as a background, with this as a background, Dr. Amalraj and myself, we thought that let's look into how the state of Kerala, the initiatives the state of Kerala has been taking up to manage so many events parallelly. And we have a very, rich experiences since the last 2-3 years, which the state of Kerala must have, even shared otherwise also. And we have with us two good resource persons, two esteemed delegates with us to share their experiences. We have with us Mr. Anu S. Nair, who is the Deputy Collector, Revenue Department of Kerala, and we also have Ms. Noshaba Naz with us. So they will be sharing their experiences of how they have been dealing with so many, what we keep harping and saying, that as a country we need to now look into the multi-hazard scenario and deal with the multi-hazard aspects. So with this background, we will start with this webinar formally. So Radhna, can you just present a couple of objectives and then request Amalraj sir also to say a few words. Over to you, Radhna.
Thank you, ma'am. I'll be stating the objectives of multi-hazard preparedness during the COVID pandemic. The first objective of this webinar is to understand multi-hazard preparedness in LSG level, Kerala, and innovation intervention. Second objective is informing contemporary policies across diverse multi-hazard scenario, defining and addressing the gaps in disaster preparedness strategies and resourcing. Our webinar also highlights multi-hazard preparedness in Kerala state with special focus on COVID-19 initiatives and implementing a future planning system approach into contemporary COVID-19 mitigation strategies. So these were the objectives of the webinar. I would like to welcome Mr. Amalraj, if he could give opening remarks for the webinar session. So over to you. Mr. Amalraj, sir? If sir is not available, then we can move ahead with the session.
I think Aradhana, go ahead.
Yes, ma'am. Okay. So without wasting much time, I would like to invite Ms. Noshaba Nas from Thrissur district of Kerala state. Her research work entitled Intervention of Faith-Based Organization in Post-Disaster Intervention, case study of Kerala tsunami was well appreciated by research community. She has worked in various national and international organizations in India, such as Doctors for Youth, Navi Mumbai, Spears India, etc. She was actively involved in Kerala flood 2018 disaster response through ADRA and NGO in Alappuzha district in a WASH project. And at present, she serves as district planning coordinator, wearing LSG in Kerala Institute of Local Administration. We welcome you to our webinar, ma'am. Over to you.
Thank you. Respected patrons of NIDM and Institute of Land and Disaster Management, Coordinator of NIDM, Dr. Ma'am, Sri Amal sir from ILDM, respected speaker person Anu sir, moderator Aradhana, very good morning to all of you and very good morning to all the participants in this webinar. My topic of presentation is multi-hazard preparedness in local self-government level, Kerala and innovative intervention. This is a PowerPoint presentation, so kindly look onto your screen, please. The key component of this presentation includes hazard and vulnerability profile of Kerala, state-specific disasters, flood 2018 and how it's impacted Kerala people and how it dragged the innovative ideas up to preparing local self-government level disaster management plan. So here is the first point, geography of Kerala. In the picture you can see the west side is surrounded by Arabian Sea and the east side is covered by Western Ghats, and the black color portion, this geographical entity has divided into three parts, and the black color portion is highland area and the white line is coastal line, and in between there is a gray line portion which is middle land. And Kerala is having around 44 rivers, 90 kilometers of coastal line. And the density of population is very high comparing to other states. The density is 860 per person per kilometer. And this area has humid equatorial tropical climate. The dominant climatic phenomena is southwest monsoon and northeast monsoon. So due to these diverse geographic features, Kerala is more significant to produce more hazards and vulnerabilities. Kerala is very multi-hazard prone area. And within a short period of 18 years, Kerala has witnessed a rapid socio-economic transformation from an agrarian society to a highly urbanized consumerist society. So this has resulted for a widespread of vulnerabilities across the state. So coming to the next slide, state-specific disasters. Here disasters are classified into natural and anthropogenic causes. Nowadays, the most crucial disaster in Kerala has become flood. We have gone through the dangerous situation of flood in 2018 and 2019. It says that 14.5% of the area is prone to flood. More than 50% of the area in Alappuzha districts are identified as prone area, and the 27 taluks are affected by riverine flooding every year. And coming to landslide, between 1961 to 2016, a total number of 295 persons were dead in 85 major landslides. Drought, the water scarcity problem is very severe in Kerala. In the period of 1881 to 2000, Kerala has experienced 66 drought years. coming to light, it's a very frequent phenomena in the month of April, May, and October and November. And when we take the average death per year, it comes around more than 70 and injuries around more than 100. And coming to coastal erosion, beaches are exposed to high waves and storm surge. And for earthquake, Kerala in the third category. And coming to the wind, cyclones and winds are prominent here, and Burevi, we are also facing the Burevi, and soil piping has reported in Kerala. And coming to the anthropogenic hazards, human epidemics such as malaria, dengue, chikungunya, hepatitis, and one are very prominent, and the rate is very increasing, and most of the time most of the cases are reported first in India as in Kerala. In the pandemic also, the corona case first reported in Kerala. One of the notable animal epidemics was anthrax, and plant diseases, pest attacks are very common in Kerala. And coming to Stampede, Kerala is very famous for annual prayers and religious festivals like Shabarimala, Artugal Pongala, Thrissur Puram have a high probability of stampede incidents. Along with this firecracker explosions, and coming to the industrial accidents, Kerala has 42 major accidental hazard unit, and petrochemical transportation accidents and vehicles accidents are high in Kerala. According to the National Crime Bureau, crime records, accidental drowning is very increasing in Kerala. It says that around 1,500 people die per year due to the accidental drowning. And Kerala, for the vehicle accident case also, Kerala has 8 national highways and 77 state highways. So PWD departments has spotted more than 200 black spots as accidental prone area. Again, oil spills and whose tragedies are happened in Kerala. Coming to the next slide. Kerala's exposure to climatic and geophysical hazard. Looking at the picture, we can see the red mark shows the disaster is very highly exposed or having high potential impact, and the pink color shows it's moderately affected. So for the flood, the future of the flood is already we have a dangerous situation. Already we have faced a dangerous situation. So future of the flood is like highly exposed and highly potential. And coming to the drought, based on the state's DRM analysis, it's evident that more than 50% of the land area of the state is moderately or severely drought susceptible. So there are the cases of different types of disasters, the ratio and the percentage is increasing day by day. Coming to the next slide. You can see on the bottom line, the green, there is no green color. The yellow color shows it's slightly exposed or low potential impact. Coming to the sea level rise, paddy fields and filtration ponds are other susceptible areas highly prone to sea level rising in Kerala. And coming to strong winds, the water spouts, gust notes also experienced in Kerala. And coming to the tsunami, we already faced tsunami in the year 2009. And in the beginning, Sushma ma'am said how it was devastated the Kerala state. And landslide, coming to landslide, is highly potential and highly exposed. It's known that total 65 fatal landslides occurred between 1961 to 2000, causing the death of around 257 individuals. Next slide. So taking in the area vulnerable to hazards, Kerala having around 75 taluks. Out of 75 taluks, 50 are prone to land. 75 out of 75 taluks are prone to flood, and 24 taluks are prone to coastal hazards. Coastal hazards in terms of high waves, storm stirs, and swell waves, etc. Coming to the next slide. What are the underlying risk factors? Why Kerala is more vulnerable or more susceptible to disaster? One of the reasons is unsustainable and weak management of natural resources and poor awareness of the changing climatic condition, like degrading environment, extensive exploitation of natural resources and deforestation. And second point is lack of awareness and anticipation of disaster risk. Weak institutional capacity to deal with high intensified disasters, inadequate early warning system. This happened in OP incidents. And poor maintenance of existing assets, like, for example, poor maintained roads, erosion of river embankments, encroachment into water bodies, inadequate stormwater drainage and filling of traditional water storage reservoirs, increase in floodplain, also result for increase in flood management, high density of urban areas. Kerala is rapidly urbanizing, also influences uncontrolled expansions. This uncontrolled expansion can lead into uncontrolled vulnerabilities. And poorly enforced land use pattern and practices. Current Land Use Regulation Act in the Kerala states are based on the Paddy and the Wetland Act, River Management Act, Kerala Municipal Building Rules, and Kerala Panchayat Building Rules. So these orders are not connecting to single management policy or regulation. So that also lead for a enforced land use pattern and practices. Coming to the next slide. Hazard seasonality matrix. In the left side, you can see the hazards types, and in the left side, which time it occurs. Flood and landslide occurs in the monsoon season, and the drought and heat waves in summer season. And lightning incidents are frequent in the month of April, May, and October and November. Coming to epidemics, most of the time it's in the monsoon season, but you can see in the case of pandemic, we are throughout it has prevailed. And earthquake and tsunami and anthropogenic hazards, it doesn't have a time bound. It's always predicted and anytime can happen. So coming to the next slide. What happened during the 2000 floods? Between June 1st and 19th of August 2018, our state Kerala went through the worst ever floods in the history since 1924. 1/6 of the state's population, about 5.4 million of Keralites, were affected. 2018 is the remarkable in the history of disaster preparedness in Kerala. This has brought milestone changes to Kerala. In the history of independence in India, where all the districts in the state are fall into red alert, that happened in the 2018 flood. Due to this, we can say that all the citizens of Kerala were involved or affected directly or indirectly to the disaster 2018. And then next is how Kerala withstand. Before that, we have this is some notable remarks of 2018 flooding. This rainfall was about 42% above the normal, and in June it was 15% of above normal, and in July it was 18% above normal, and from 1st to 19th of August, it was 164% above normal. And it says that around 1,259 villages were affected, and all 14 districts were fall into red category. 35 dams across the states were opened to release flood runoff, and all 5 overflow gates of Idukki Dam were opened for the first time in the 26 years. Nearly 341 landslides were reported from 10 districts. Idukki district was ravaged by 143 landslides. Around 5.4 million people were affected and 1.4 million people were displaced in terms of like they are relocated to temporary relief camps. So coming to how Kerala withstand. The next, how Kerala withstand. The government of Kerala conducted time an efficient rescue and relief operation with heavy support of communities mobilizing on their own and effective application of information technology and social media by voluntary youth groups. Even in the Kerala State Disaster Management Authority has played a critical role in the coordinating emergency rescue and relief operations. Relief assistance was provided to people in camps, including immediate food supplies as drinking water, kerosene, wheat, pulses, and other medicines, clothes, and other life-saving items. And an amount of 10,000 has given to family those who have relocated to relief camp and stayed at camps at least for 2 days, and compensation has given to fully and partially damaged houses. And the role of Kudumbasri played an extensive role in these efforts. They have cleaned the houses and public offices, provided counseling to the family, managed community kitchen. They also collected an amount of 11 crore and given to Chief Minister's Relief Fund. And role of civil society organization. This is one of the notable point in this slide, like a role of civil society organization. The organization capacity and the unity is the strength of even if we take 100 Malayalis, out of 90 Malayalis will be a member of an organization, like any reading club. To cope up or to withstand and to ensure the immediate needs after the flood. And coming to the fishing community of the state, they also played a wonderful job using their boats and equipments, and they have saved around 65,000 of lives in Kerala. And coming to existing institutional mechanism, we have a look on this timeline of disaster management in Kerala. Kerala State Disaster Management Authority has constituted in the year 2007, and the District Disaster Management Authority established in all 14 districts in 2008. State DM policy formulated in the year 2010. At the same year, Revenue Department renamed as Department of Revenue and Disaster Management in 2010. Very high frequency network were established in villages, taluks and collectorate in the year 2019-11. State Emergency Operations Center made functional in 2012, and State Disaster Mitigation Fund was created in 2012. KSDMA reconstituted in 2013. Then Departmental Plans of Health and Fire Force and Water Authority was prepared in 2014. I'm not telling all the pinpoints, I'm just saying the major ones. District disaster management plans of all 14 districts were published in the year 2015. So these institutional mechanism was prevailing in Kerala. And the KSDMA, you can see Honorable Chief Minister is the chairman of the SDMA, and there are board members. Director of ILDM is one member, and the State Executive Committees. Chief Secretary of the State Executive Committee is the CEO of KSDMA. And SDMA take all policy decision maker. For taking all the policy decisions, SDMA meets once in a year. State Emergency Committee takes all routine and administrative decision and meetings at least once in 3 months. And to the next. This is the information flow diagram of emergency operations in Kerala state. This work very well in the flood situation. In the center, you can see State Emergency Operations Center, where early warnings are disseminated into central forces, media, state incident commander, and home secretary. In the bottom line, they also disseminate the early warning system to district incident commander and to district emergency operations center. From district emergency operations center, it goes to deputy director of panchayat, district medical officer, district police chief, district fire and rescue officer. And in the bottom line, DOC also connects the early warnings mechanism to the taluk level, village officers, and block and panchayat level. And from there, it goes to the vulnerable community. Next. And this is the desk management of DOC, District Emergency Operations Center. A district incident commander is always come as district collector, and following him there is a deputy collector for disaster management or additional district magistrate. He has to control these six desks in the time of emergency: information, logistics, health, services, and resources. And this is the executive committee the district disaster management authority. It has constituted in the year 2008, and the district collector is the chairperson, along with district panchayat president is the co-chairperson. Additional district magistrate come as a member, and then superintendent of police, DM, district medical officer, district fire and rescue officer, and an engineer from either from irrigation department or agricultural officer. So this is the body committee of district disaster management authority, and they have to meet once in every 3 months, and the minutes and the report has to be sent to state emergency operation and the other DM concerned departments. And to the next, the Panchayat committee. This is a tentative body. Like panchayat president is the chairperson, village officer is the convener, police, fire and rescue, health department, agriculture, animal husbandry, and the board members, key political party representative, and eminent prominent school teachers are the committee, comes into the panchayat disaster management committee. So the point was this system was prevailing and they were actively participating in the disaster preparedness, especially in the context of 2018 flooding and 2019 flooding. Coming to next. The vision that flood should be taken as a challenge and an opportunity to rebuild the state to ensure better standard of living to all sections of the society. The Rebuild Kerala initiative attempts at a bold vision for a Nava Kerala, new Kerala that is more resilient, green, inclusive and vibrant. So the scope of Rebuild Kerala initiative has divided into 3. First one is geographical scope. In that, all the 14 districts were affected, but as a priority, they have selected the worst affected 7 districts. And coming to the cross-cutting sector, the sectoral scope includes like disaster risk management, climate change, environment, governance, agriculture, livelihood, fisheries, etc. And coming to the temporal scope, multi-program involving several government departments and agencies period of 5 years. Medium and term intervention in rebuilding shelter, infrastructure and livelihood. So these are expected to complete within 1 or 2 years in a short period of time. So coming to next slide. Rebuild Kerala core guiding principle. This has 8 core principles. First one is fast, efficient, and inclusive. Inclusive in terms of inclusive of women, children, elders, and the disabled person and the marginalized, transgender, etc. And improving resilience in terms of elevating flood-prone road, slope stabilization, bioengineering techniques, landslide protection, etc. And innovative and modern, build back better philosophy. These principles will include improved design, sizing, siting, and orientation of the DM perspectives. And coming to innovative and modern technologies, alternative surfacing and paving technologies based upon availability of local resources, and the capacity building programs where ILDM, Institute of Land and Disaster Management, plays a key role in Kerala. They are giving training on variety of DM aspects and encouraging young professionals to carry research activities. Then building asset management framework, simplification of process, and if you have any idea or theme related to your surrounding, which you think as a sustainable developmental activities, your ideas are welcome by Rebuild Kerala initiative. This is all the procedures are made available in vernacular language. So this help people to connect with Rebuild Kerala initiative. So the next. This is Nammal Namukai. Rebuild Kerala initiative has launched a campaign by the name Nammal Namukai, means we for us or we for we, with the aim to utilize the knowledge, experience and idea of the entire people of the state in a participatory and practicable manner for rebuilding Kerala. So this Nammal Namukai program has two major components. One is extensive campaign with active participation of the people to identify required corrections and policy changes to ensure resilience. And second, preparation of disaster management plan at every local government institution. Coming to the LSG, through the LSG, like the grassroots people who withstand with indigenous technologies and local resources, and to maintain a disaster preparedness culture in the community. So through the People's Campaign for Nammal Namukai, State Disaster Management Authority and Kerala Institute for Local Administration has taken this initiative to prepare the LSG level disaster management plan along with state planning board. So these are the stakeholders of LSG level disaster management plan. And for on different stages of campaigning, for this they have working groups saying LSDs, they have collected data regarding this and presented in Gram Sabha, Board Committee, and some developmental seminars were conducted and drafted the document according to the template and submitted to the district planning office. They have to verify and this has to be approved by district disaster management authority. So it is the very first time in the country where a state having local level disaster management plan and all the gram having a deep knowledge on disaster management perspective. So coming to the content of local level disaster management plan, we can go through the slides of Nedumudi Grama Panchayat plan. So can you please open the PDF document?
Yes, ma'am. Few seconds.
This will help you to get an understanding on how LSD level disaster management plan has prepared. And what are the chapter-wise content? This is the Nedumudi Grama Panchayat plan. This is the first prepared plan in the Kerala, first prepared LST level plan in Kerala. Go down, please. This is the chapter content. It has 7 chapters and annexes. I will come to each chapters. Chapters. This Nedumudi Panchayat is situated in the Chambakulam block of Alapi district. Then, down please. This has a message from ministers. That's in Malayalam. And the chapter 1, local self-government institution and general information. Go down, please. Faster, like Nedumudi Grama Panchayat, it has listed out geography and history of the area, history of disasters, history of floods. This Panchayat has, down please. This Panchayat has experienced viral diseases in fish. So they have given a description on what are the disasters affected in the Panchayat and how it got affected. And the population statistics, you can see there is a column for transgender and ward level information. Go down. Financial status information, in which we can see how many yellow card the ration card holders. So how many are yellow card holders and how many are blue card holders. So this will help you to prioritize who is the most marginalized community which are in the local. And the major occupations, who are the government workers, who are small traders, what are their main occupation, and how many poultry farms are available in the community, and public livelihood infrastructure. Go down, and educational institutions, and details about Anganwadi. Also, they're asking, is it having a non-building or is it blended? Healthcare institution, veterinary hospitals, dispensary. So these detail, and the community centers and halls, they're asking availability of water, whether the place is electrified or not, is they having community kitchen, toilet and bathrooms. So this will help you, like in the emergency situation, these community centers and halls are converted into emergency relief centers. So this data will help you to sort out that problem. And religious centers. Roads, bridges and related structure. What is the status of roads and bridges? They need any repairing or this as it is strong? And the residential building information, how many houses are concreted, how many vacant houses, how many houses are tiled, how many houses are like using the asbestos sheet, and low-income colonies and residents. How many low-income colonies are existing in the village, and how many families are residing over there? And irrigation and hydroelectric systems. Like the first chapter includes the primary information. You can go to the next chapter.
I guess the content.
It's in the down only. Yes, the chapter two is about climate change and disaster potential analysis. In the table, you can see the temperature, humidity, and course of wind. And the data is asking, like in the last 30 years, whether the temperature has increased or not, whether it is decreased, you have to mark that. And is there no change, then you have to mark that also. And satellite view of Nirmudi Panchayat has given. And flood affected areas of Nedumudi Panchayat, and how the climate change has impacted the environment. So this information is like they're collecting from locally. And how the climate change impacted the people's lives. And history of disasters faced by local self-government. Here you can see 2000 and 2018 and 2019 flooding. Number of casualties were made. Histories of local disasters and how many number of houses damaged, infrastructure damaged, cultivation damaged, agricultural damages, casualties, number of deaths due to the infectious diseases and all. Go down. See and the section that needs special consideration, in which you see migrant laborers, population residing in care homes, pregnant women, above 60 years of age, palliative care patients, differently able patients, children below the age of 5, etc. And the transgender and disaster risk areas. Geographically disaster prone areas. And economic weakness. And the chapter 3 contains disaster response plan. What are the preparatory measures they have taken and potential invitees? And they have listed out warning team, search and rescue and evacuation team. In the table, you can see taking to the shelter management team. Yes, here you can see there are male and female are equally important while considering a shelter management team at a ward level. There is equal participation of women and first aid and basic life support team. Volunteers' name has listed out. An evacuation plan for flood. And chapter 4 is preparation, mitigation, and social empowerment. What are the preparation activities can taken? Like route to rescue the team, drought disaster risk information. So this table shows in each disaster what are the preparatory measures have to be taken, what are the escaping routes, what are the evacuation plans. Please. And social supporting system as NGOs, so different organizational setup. And chapter 5 is resource and capabilities. This is more of equipments and resource info. We do update on IDRN side how many equipments are available, name of the owner and phone number is given. Ambulance holders and the human resources, NSS workers, NSCC workers, different youth organization, etc. And availability of drinking water. And chapter 6 is project proposal for disaster mitigation, where the chapter is discussing about what are their annual projects which already were executed local self-government level, how they can enhance the project into disaster risk management project. Go down. So after preparing this disaster management plans, most of the panchayat are coming out different ideas to ensure the future disaster impact of locality. And chapter 7 is important phone numbers. Important phone numbers of steering committee of panchayat, details of ward members, details of health institutions, and details of veterinary services and helpline numbers. So this is the basic idea of preparing LSGM plan. So all the 7 chapters will help you to have a deep knowledge on local disasters and how to cope up with it and how to prepare well. So according to this plan, LSG level committees are preparing mock drills and they are preparing developmental seminars and they are drafting some templates and all. So this will help you to ensure all the resource and capacities are in place, and that will help you to withstand with the next future disasters. Thank you. My presentations are over.
Thank you. Thank you, ma'am, for such an in-depth, detailed, and very informative presentation. Moving ahead with the session. Moving ahead with the session, I would like to invite our next speaker, Shri Anu S. Nair, is a Deputy Collector in the State Civil Service Executive of Kerala State. He is a master degree holder in social work. He was additional district magistrate to Patnam Mithai district, where the famous Sabarimala pilgrimage is being taken place. He served as a deputy collector in charge of disaster management, Trivandrum district, and the capital city of Kerala state. He is actively involved in the domain of Sabarimala crowd management 2016-17, flood management 2018-2019, and many other such activities. His involvement in the COVID-19 response played a pivotal role in minimizing the spread of disease in the district. He presently serves as the Assistant Commissioner Land Assignment in Kerala. We welcome you to our webinar, sir.
Thank you for a nice introduction. Good morning, everybody. Dr. Sushma Guleria, who is the Assistant Professor of ILDM. My friend, Dr. Amal Raj, he is the Assistant Professor of ILDM. My co-speaker, Ms. Naushabha Nas, and the moderator, Aradhana. This is the, can I share my presentation here?
Yes, sir.
How can we share?
Yes, share? I will make you the presenter, so just...
Do you share or I should share?
No, sir. So just...
Okay.
Make you the presenter and then you'll be able to share your screen.
Yeah.
Yes, sir. Yeah.
I think there is some compatibility issue here.
Yes, sir.
Ooh.
So Radha, you share it from yours.
Yeah. I will share that PPT thing. I think this PDF has been an issue. Yeah. For the past 1 hour, we have been discussing about the Kerala scenario, how we have been able to tackle with the multiple hazards in the past few years. Actually, in the modern time, after the independence, the Kerala has witnessed the major natural disaster in the year 2004 in the form of tsunami, which we have lost nearly above 100 lives, particularly in the coastal districts of Alappuzha and Kollam. It is in the year 2004. And after that, in the year 2011, there was a stampede in the Shabarimala pilgrimage season. In 2016, the local temple at Puttingal in Kollam district, there was a explosion, firecracker accident was there, and we lost more than 100 lives there. 2017, we faced Oki, even though it did not made a landfall in Kerala, it passed through the Arabian Sea, where fishermen was engaged in fishing, and we lost more than 150 lives in the Oki. And 2018 and 19, we have consecutive floods in central Kerala and in North Kerala. Also, landslides were there. In 2020, we are among the global fraternity to fight COVID, landslides, and we have an aircraft accident also in the 2020. This was the disasters that we have faced in the recent years. So I'm not going into the very details what my co-presenter has been shared. So to get a gist of Kerala, please, the earlier slide, please. Yeah. Kerala, we have 14 districts, and our population is nearly 3.34 crores, which means a density of 859, one of the highest in India. And we have 75 taluks and 27 revenue divisions, and revenue villages, it's 1,664. We have a robust local self-government institutions in Kerala, and in Grama Panchayat, we have 941 Grama Panchayats in the village areas. Block Panchayat, it's similar to the Mandal Panchayats, and it is 152 in number. We have 87 municipalities and 6 corporations. Nearly 40% of our population live in the urbanized areas. Also, some Grama Panchayat has been classified as an urban agglomeration in the census point of view. So this is the basic demographic profile of the state of Kerala. Next slide. Yeah. What are the susceptible hazards which Kerala will face? We have floods, everybody knows. Also drought. In the year 2016, we faced a severe drought here. And the drinking water scarcity was very, very high. The drought, what we see in Kerala is totally different from the pan-national scenario. Here we have some 44 number of rivers, but these rivers are very, very small in its nature. Some are some 30 kilometers, 40 kilometers. We here classify it as a river. So 4 or 5 major rivers are there having more than 200 kilometers of length. So the drought is a severe scarcity of drinking water that we usually face in the summer seasons. Then of course landslides. Lightning. Lightning is declared as a state-specific disaster in Kerala. And also the sea erosion. Because we have a long coastal area, long coastal stretch. The entire state has a long coastal stretch, and the population in the coastal area is pretty high. The population in the density in the hilly area is very low, but It is compensated by the highly density population in the coastal belt. So the coastal belt have a population density of more than 1,100 and plus. So the sea erosion is a pretty good challenge to the living of the marginalized community of fishermen. Then tsunami in 2004 we witnessed it. Cyclones, it is not that very common in Kerala, but in 2017 we have a Aki cyclone, and now we are going through a cyclone, and today 5 of the districts has been closed. All the institutions, all the government offices has been closed due to the cyclone, for the cyclone preparation. And epidemics. Epidemics is the major challenge that we are facing. In 2018, we faced a Nipah, which is very localized in Kozhikode district. But Nipah is a very dangerous epidemic, and we have faced Nipah in 2018, and in 2020, obviously the COVID is there. Then the fire disasters, like what happened in Puttingal and in other commercial areas, and stampedes and chemical accidents are also there. These are the major hazards that the Kerala state is facing. Yes. Next slide, please. Coming to the COVID situation, we should have a general assessment what the COVID and how we have been facing the COVID. As all of us know, Kerala is the first state in India to have a declared COVID patient. That patients came right from the Wuhan, who were the medical students there. 3 of them came from Wuhan, and they were tested and identified COVID positive in the month of January itself. It is in the Thrissur district. But after that, the state has done very good effort in fighting COVID. We all know that Kerala has a best health indicators in the nation. Our health indicators are very above the national average. It's from the time of independence, we have a very good health indicators, and it owes much to the social determinants of the health. Our literacy rate, female literacy rate, sex ratio, these are all the major contributing factors for the better health indicators. So also we have a robust public health infrastructure throughout the state. All the panchayats in Kerala, do have a primary health center which treat the patients in the allopathic system. Apart from that, each panchayat do have a Ayurveda dispensary and a homeo dispensary, and at least there will be 3 doctors, one Ayurveda doctor, one modern medicine doctor, and a homeopathic doctor in every panchayat. And also we have a very good system of taluk secondary level hospitals in taluk and block CHCs, community health centers, and district hospitals. Then general hospitals are there, and 8 government medical colleges are there, and the public health infrastructure and public health workforce is pretty good comparable to the rest of India. So the state has a advantage when compared to other states in fighting the epidemics, and we have been able in achieving to reduce the spread of COVID in the state. So, looking at the numbers, Kerala has so far have 5,56,000 COVID patients, and among them 2,329 lost their life, which is the case fatality rate is about 0.5%. When we compare to India, it is 1.28%, which means those who are infected, 1.28 of the patients infected by COVID died in India, whereas it is only 0.5 in Kerala. The world average is double our national average. It is 2.32. So, in the saving life of those who are infected with COVID, the state is performing pretty well. Also, the recovery rate. Recovery rate, it denotes the present scenario. The world, it is 71.58. Kerala is 89.8 and 94.1. It is high. It is dependable on the rate of incidence. It is not a static figure. It is a very dynamic one. We will understand why the recovery rate varies. Can we move on to the next slide? Yeah, this is how COVID traveled over the world. We can see the total, the green bars are the persons who are infected with the COVID, that is the COVID cases, and the yellow line denotes the death rate, not the number of death, but the death rate. We can see that November is the highest number of cases reported throughout the world, throughout the globe. It is increasing steadily. In January, it is less than 10,000 cases, and now it is more than 1,70,00,000 cases. That is, the November alone witnessed 1,70,00,000 cases. Whereas the October, it is 1,19,00,000. In September, it was 84 lakhs. So across the globe, we see a phenomena of rising numbers in COVID cases over the period till now. Next slide. But when we come to the national average, India had a peak in the month of September, which means from October, November had seen a decline in total number of reported cases in India. That is why the recovery rate of our nation per se is higher than the world average, because in world the largest number of cases has been reported in November, whereas in India it was in September. So after 14 days or 20 days or 10 days, as the case may be, the patient will get cured and he will be out of treatment. So the recovery rate depends upon the number of patients who are presently treating, which is the numerator, and the denominator is the total number of cases. If the cases goes on increasing, then the person under treatment naturally goes on increasing, which will in a way reduce the recovery rate. Okay, next slide. In Kerala, we see a largest number of cases in October. So comparing these three things, that is the world average, November is the highest. In Kerala, it is October is the highest, and in India, it is September is the highest. These three changes is reflecting in the recovery rate. So the recovery rate denotes the present rate of incidence. It is the clear indicator of the present rate of incidence. This is how the COVID has been traveling through the various geographical locations. Now, on the basis of COVID, we have to discuss, we have to think about a post-COVID scenario. We all know that the life has changed very much. Usually these types of deliberations happen in a real world, not in a online platform. We will assemble in some places, some training institute, we will discuss. And now these types of agglomerations, these types of meetings are not happening anywhere in the world. Even my kindergarten boy, he is learning his alphabets through the computer. It was not, we never thought of it a year before. A kindergarten student opened his computer and teaches and learns alphabets. We are not, we did not thought about such a situation 1 year before. That is the difference that COVID has been made. So the life has been changed in a drastic manner. Same has been affected on the disaster management planning, disaster management preparation, everything. So in the next few minutes, we will focus how the COVID scenario has been affected our disaster management preparations. Next, sir. The hazard preparation has basically 3 phases. One is the planning phase. Second one is the phase of organization. How to implement is the third phase. And we should have an overall picture about these 3 major components of the disaster management preparation. So planning, we can move on to the next slide. How are you going to plan to deal with a natural disaster, or for that matter, any kind of disaster? What should be our plan? Where should, who should plan? Is the national authorities or the state authorities or the district authorities or the panchayat authorities? Who should plan? Talking from a Kerala state specific scenario, I can say that there is obviously a national plan is there. It is applicable to the nation per se. In the state of Kerala, we have a 3-tier system of planning. First one is at the state level, and it is headed by none other than the Kerala State Disaster Management Authority. And at the district level, District Disaster Management Authority is there, which is the part and parcel of the district administration. And from this year onwards, as we have seen in the earlier presentation, in Kerala, we introduced the planning at the local self-government level. So the 3-tier planning system is there. Now, on the COVID scenario or the pandemic scenario, what difference has been made? The SDMA in 2019 has prepared an SOP called the Orange Book of Disaster Management. It is basically dealing with the monsoon preparedness and the response. What should each department do? What should each officers do during the monsoon season? We all know that monsoon is the season of heavy rains, floods, landslides and all. So the monsoon preparedness is the very crux of the disaster management activity in the state of Kerala. So in this 2020 version, in the 2020 version, which is the second version of the Orange Book. In 2019, it has been issued after the learnings from the 2018 floods. In 2019, it has been issued. In 2020, the second version has been issued. The second version is particularly focusing upon the COVID scenario. It has been published in the month of May 2020. In the month of May, we are all in the lockdown, but nature do not have a lockdown. Monsoon has come in the June itself. The rains was there. Localized floodings was there. In Idukki district, landslide occurred. About 75 persons lost their life. And flooding occurs in Kannur, Kozhikode, Palakkad, central, north central districts. So we have to open relief camps. It is the period of quarantine there. It is the period of infections coming to the community. So how to deal with the relief camps? Relief camps, we all know that physical distancing is not that much possible. A person who usually resides in a 1,000 square feet house, there will be 3 or 4 members. If he has to be, the family has to be evacuated to a relief camp. The relief camp, we will not give them 1,000 square feet space. We will give them some 100 square feet of space. Also, there will not be any separate latrine facility. There will be a common, usually it is in the schools and all, where we know that when 1,000 students are there are less than 100 latrines or toilet facilities. So we have to share. Then how to deal with the quarantine people. So the Orange Book on Disaster Management version 2 has come up with the crystal clear guidelines, what to do with the quarantine persons, what to do with the infected persons, what to do with the primary contacts, what to do with the secondary contacts, what to do with the vulnerable groups. And 4 types of disaster camps has been envisaged in every revenue villages. 1 for the general public, 2 for the quarantined persons, 3 for the vulnerable persons. Vulnerable includes the aged, the pregnant ladies, immunocompromised persons, such category who are all the vulnerable persons, and special focus was given to these vulnerable groups, and finally 1 to the confirmed primary contacts. These are the 4 types of special relief camps that has been envisaged, and also the SMS protocol, which means soap, mask, and social distancing. Soap for the hand sanitization, mask, obviously we all know, and social distancing. And this Orange Book has made these components the part and parcel of the planned process. And the District Disaster Management Authority, who is supervising the implementation, who is supervising the conduction of the camps, relief camps in the district level, they have come out with district-specific frameworks for implementation and issuance of the statutory orders. Because the DDMA has a power to issue orders as per the DM Act. And the local self-government, we do have some 941 Grama Panchayats at the village level, 87 municipalities and 6 corporations, amounting to about 1,034 local self-government institutions, which all have a disaster management plan of their own in the prescribed format. This was the novel achievement. This was the novel intervention which the state of Kerala has been made thanks to the local self-government department, SDMA, and the KILA, which took the effort to materialize the panchayats, empower the panchayats to come out with such a plan. So it has been made a mandatory portion of the planning process. In Kerala, we have a very robust local government planning process is there. 40% of the state budget has been expended through these 1,034 local self-government institutions. So there is a budgeting, there is a plan preparation. This plan has been approved by the district planning committee, which is a constitutional body, headed by the district panchayat president, and the district collector is the secretary of the district planning committee, which is a constitutional body. So each and every penny given to the panchayats and municipalities will be spent through a plan which is approved by the district planning committee and approved by the local self-government through its budget, annual budget. So, preparation of the disaster management plan has made a mandatory to all local self-government institutions. So, we have earlier saw a plan prepared by the Nedumudi Grama Panchayat in Alappuzha district. So, such type of plan we do have to every panchayat and municipalities. So the third tier of planning, which we have incorporated in 2019, has been very helpful in dealing the pandemic situation. You can move on to the next slide. Yeah. Coming to the organization, how we achieve these objectives. We should have a robust organization there. And in the state level, it is headed by SDMA, and in district level, it is managed by the DDMA. In 2019, we have introduced the incident response system in the state level, and in the district level, and in the taluk level. So we do have an IRS system in the state. We do have a IRS protocol in the district and an IRS system in the taluk level. The government has issued an executive order constituting the incident command system. And this is aimed for the better coordination among departments. We know the land revenue department is there, police department is there, health department is there, local self-governments are there, fire and safety department is there, motor vehicle, public works department, all these line departments of the state government. The IRS has given a better opportunity for better coordination. And in state level, there is a state emergency operations center. In times of calamities, it works as a unified command. And the district level, we do have a district emergency operations center. The SEOC and DEOCs are functioning 24/7 throughout, whether it is a disaster situation or not. In the normal time also, it is functioning. So, in the taluk level, there is a taluk control room, and the taluk emergency operations center is being operationalized during the calamity period. Otherwise, it will be a single manned control room is there 24 hours or 24/7. But SUC and DOC, it is manned by multi-department staff, revenue, police, fire force, and irrigation will be there. So the government departments, the inter-department coordination has been beefed. And the another two major component in our organization setup is the increased engagement with the civil society. In every district, we formed an IEG, interagency group. In the state level, there is an IEG. Main objective of the IAG is to coordinate the activities of the NGOs who are actively involved in the disaster management activities. So IAG is a platform which brings all the like-minded NGOs, and a discussion will happen place there, deliberations will happen place there, and it avoids the duplicity of work. It prioritizes the area of working. So these NGOs can work in tandem with the government missionaries, augment the government system, supplement the government intervention in a more focused, in a more comprehensive, and a more cooperative manner. So this interagency group has helped a lot in the recent flooding and also in the rescue operation of the Malappuram Kozhikode International Airport mishap. And the next one is Sannadha Sena. In the 2018 flood, we have witnessed the overwhelming support from the youth community, the students, who have came forward without any formal request due to their commitment to the cause of the society, due to their commitment to those people who are vulnerable, who are facing difficulties, who are the victims of the natural calamities. The youth has been pumped in. They have voluntarily come forward to help those who are suffering. In 2019, the government come up with a department headed by an IFS officer to channelize, to organize these volunteers. And it is called as Sannadham, and a volunteer force has been created who are called as Sannadha Sena. No remuneration has been paid. It is purely voluntary basis. They can give their they can volunteer their service. They can select. They can opt for their timings. They can opt for their days. And this online platform is available to the district and to the panchayat authorities, so they can log in and checking how many youth are volunteering to help to assist the government officials. They can call them, they can utilize their service. So it is a well-structured portal, and a well-structured volunteer force is there. We have already given training to more than 1 lakh youth in the how to deal with the COVID pandemic, how to deal with the disaster management activities during COVID times. Also, another thing which I forgot to mention in my presentation is that a civil force has been envisaged in the civil defense force, in the fire and safety department, which is the nodal department to operate the rescue operations in the state. It is a well-trained group of youth. That is also a volunteer group. They will not be paid, but they will be provided with the basic gadgets and life-saving equipments. They are trained for a period of 1 month, and in every fire stations, we have 150 fire stations throughout the state, and there are 40 youth each has been identified, trained and attached to each fire station so that it will augment the fire force officials, the fire and rescue department officials in the search and rescue operations. So it is also a novel initiative after the 2018 floods. Okay, can we move on to the next slide? Yes, we have seen the planning and organization phase, and now it is implementation. I have already discussed you about the Orange Book, how we prepared it, and what are the components of the Orange Book. It is mainly dealt with the monsoon flood preparedness. What should each department, revenue department do? What should the panchayats do? What should the police do? What should the electricity board do? What should the water authority do? What should the public work department? What should the health department do? And everything. And the new book has been envisaged in such a manner which incorporate the COVID protocol in them. And another thing is the district action plan. Most of the districts has come up with a district action plan. It has been prepared. I has been actively participated in preparing one such in Trivandrum district while I was the CEO of the DDMA Trivandrum, and it was prepared prior to the Onam celebrations. So it dealt with the public gatherings, festivals, and the involvement of the community level organizations, civil society organizations, all such things. And government has issued SOPs to conduct various public examinations. We have conducted our class 10 SSLC examination in the midst of, before the lockdown happened, we have conducted our plus 2 examinations. After that, we have conducted the state civil service examination. UPSC examination has been there. Entrance examination conducted by the State Entrance Commissioner, and also the National Entrance and Eligibility Test conducted in the All India basis. All these public examinations, competitive examinations has been implemented as per the SOP. The SOP clearly mentions what should be done in the classroom level, what should be done in the exam center level, what should be done in the transportation level, what should be done in the household level, what should be done by each participants, what should be done by the organizers, what should be done by the invigilators, etc. This is a very detailed thing. So we have to follow the SOPs only. Second one is with this Sabrimala pilgrimage. There is an SOP. We all know that Sabrimala is one of the busiest, one of the shrine which attracts a large number of devotees. Particularly, it is a seasonal phenomena. The shrine is not open throughout the calendar year. It opens in the month of December, January, and from the half of the November mid, it opens and it closes by now mid of the January. So two months long pilgrimage is there, and nearly some 70 lakhs, 80 lakhs people will visit the shrine during the 60 days period, which amounts that more than 1 lakh devotees per day. And the particular of Sabrimala temple is that it is situated in a hilly terrain, well inside the Periyar Tiger Reserve, which is adjacent to the wildlife sanctuary. It is the core area of the Tiger Reserve, and it's a thickly dense forest area. So 4 kilometers of trekking is there. In such a situation, the 1 lakh persons are assembling per day. So we have to manage that. This year we have come down with strict protocols. Prior COVID testing should be there, COVID negative certificate should be there. All the officials posted there will be tested once in a week, and many stringent mechanism has been brought in, and also the prior booking has been made mandatorily. Earlier it was an optional, so that you can ensure your darshan at that specified time, or else you can wait in the queue. So from this year, it is not there. Only the pre-booked devotees can enter the shrine, and the number has been very much restricted. But we are conducting the pilgrimage. And also there was SOPs to the rescue operators in the disasters of landslide in Idukki district, aircraft accident in Malappuram district, the Kozhikode International Airport, and SOPs was there. Also the SMS campaign, SMS activity, the SOP of functioning the office, SOPs of functioning the shops and commercial establishments, SOPs to conduct the cultural, social and the political activities. All these has been implemented in the field with the active involvement of the local self-government, revenue department and police department. The health department was there, but they are more or less concentrated in the treatment aspect and in the quarantine aspect. The other physical activities has been regulated mostly by the LSTD, supported by the police and revenue department. We can move on to the next slide. So, we have been discussing these points, and from all these points, I came these 5 conclusions, which as a takeaway message. One, there should be a strong and clear guidelines of what to do, how to do, when to do, and who to do. This should be clear, because in a pandemic situation, the disaster management activity, rescue activity, relief activity itself should not become another disaster. So our disaster activities intended to rescue the life, providing relief to the victims, that activity should not become a disaster. For that, we should need strong and clear guidelines. It is a very must thing. Second thing is how to implement these things. We have government systems, we have district disaster management authorities in each district, we have SDMA in the state, which is more or less a regulatory mechanism. The activities in the districts will be headed by the DDMAs, but in the field, it will be headed by the local governments, it will be headed by the village officials, it will be headed by the station house officers of the police stations, etc. So there should be a robust organization which communicates to each other. Proper command should be there, proper feedback should be there. If proper command and proper feedback, a proper communication system has been envisaged there, then the information gap will be less, then the information will pass on in a very clear manner. What is the field reality? It will be get reflected to those in the state level. They can plan accordingly. They can foresee the events, foresee the situation, and they can plan accordingly, and they can issue guidelines which should be clearly taught to the officials in the field. So the robust mechanisms should be there. And 3, civil society should be engaged in a meaningful manner. In a meaningful manner, which I say means all the organizations, we have residents associations, we have flat owners associations, we have the associations of the commercial establishments, we have the organizations of the labor, auto rickshaw drivers, taxi drivers, and other working class people. We have to take into confidence of each and every part of the society. Otherwise, in a pandemic situation, we cannot contain either the pandemic or we cannot effectively do the relief and rescue operation. So we should take into the confidence of the entire civil society along with the government organization. For that, we need constant IEC and media management. Because what the common people imbibe is what they are being fed by the media. So media should be properly informed, otherwise they will spread what all the information they get. If they get false information, the news they produce will also be a false news, and its impact will be very disastrous impact will be there. It will not helpful for any officials for the matter, for any government for the matter, to tackle such a situation. So the constant IEC, information, education, content should be, communication should be given, media should be properly managed, and last but not least, the youth power of the society should be channelized. We are the nation with the largest number of youth population. Our youth population is largest in the world. We should tap the resource, the human resource available with our youth, so that it will reduce our time, it will reduce our redundancy and all. And the efficiency will be very higher if we properly take care of the unbridled power within the youth. These are the 5 major takeaway message that I can give at this point of time. I'm very much thank you to one and all to have a patient hearing. And with these words, let me conclude my remarks. Thank you.
Thank you, sir. Thank you for such knowledgeable and such enlightening presentation. Moving ahead with the session, we have reached to the question answer round where we can interact with the participants. If any participants wants to ask question, we shall unmute you. There's an option to raise hand, or there's a section of question answer. They can ask their questions there, and the speakers, the panelists, can directly address the questions.
Yes, sure.
Yes, sir.
I think there's a question in the chat box, but I'm not sure. Is Dr. Amalraj around?
Yeah, he's here.
Okay. Yeah, sir, actually, it's a question related to the use of GIS, so I'm not too sure. So Chetan wants to know how can, we enable remote sensing and GIS usage in a multi-hazard preparation. What should be the coordination model regarding this? if any speakers wish to just throw light upon it. Perhaps the use of GIS in a multi-hazard disaster preparation or management.
Multi-hazard solution map on the. So regarding the GIS activities in preparing multi-hazard zonation map, actually this was the first kind that we did. Would you please go to the next slide? In that slide, we have a multi-hazard zonation map prepared by the National Center for Earth Science Studies, which is recently updated by the State Disaster Management Authority. In the next slide, you can see the next slide. Oh, you are presenting. Are you able to see the presentation? Just a moment.
Sir, shall I share the presentation again?
Yeah,
that's fine. Yes, sir. So just a few seconds. So may I know which slide number?
I think before this, maybe in the this slide. Yeah, this one. See the map of Kerala in which this one is a multi-hazard zonation map which is prepared using in GIS platform, and actually this was prepared in the period I think in 2010, and in this map they mapped the landslides, floods, and major lightning strikes. Then I think storm surge affected areas, tsunami affected areas, then other earthquake prone faults. All these are mapped in this, and thus the institutions that they are going to develop something, say a hospital is going to be built in a lightning prone area, they will ensure that there is lightning arresters. So to that level of preparation, this is effectively useful, and at the same time we have some risk, because the maps that we derive, say for example in the case of flood map, or even using in this particular map, we used the scale of 1:50,000, which is insufficient for developing a flood hazard zonation map. Probably we need a better scale map. So in that way, it has some limitations also. So I think anyway, effectively we can use GIS if we go a bit more, or a micro zonation level. If we can go, this would be very much effective, I would say.
Thank you so much. There's another question by Dr. Shravan. So he says that like floods are for states like Bihar, it's something usual and common. But if it's a flood scenario and then parallelly you also have the COVID-19 situation, how easy or difficult is it for a volunteer to respond?
Would you please be able to answer, sir?
I mean, it's like you have the COVID as the backdrop, and then you have floods, and you need to deal with the floods and the COVID situation. So how for a volunteer it's going to be easy or difficult, to be a part of the response teams? I mean, any experience if you can share?
Yeah. We do have a centralized volunteer registration system where we collect all the details of the volunteer along with his phone number and all. And it is being sorted in a panchayat wise, and the panchayat secretary, when he log into the portal, he will get the details, contact details of all the volunteers. From the panchayat office, they will contact the volunteers, they will SMS either, or they will call the volunteers, and the volunteers will also contact the panchayat office. So a communication will be happening place between them. They will be provided identity card, and they will be provided a briefing in the panchayat office itself, and the panchayat officials and the local revenue officials or police officials will guide the volunteers this system works pretty well because we do have an internet facility throughout the state. Only the remote hilly area, it will be the connectivity issue will be a problem. Otherwise, mostly 95% of the state has been have a very good internet facility. Connectivity is there, so the communication will happen both sides in a very good manner. And also they are very localized. If I am hailing from a village and I will register and I am residing in that village only, so the transportation is not a big issue. They can perform their voluntary service near their residing place, near their house. So transportation is not an issue. And we do have a mechanism called community kitchen. During the COVID lockdown period, where we have in every panchayat opened a community kitchen. The community kitchen will prepare food for category A, who are in institutional quarantine centers, category B, who are the workers, migrant workers from other states, category 3, who are those people who are residing in the house and unable to cook their food on their own, including aged persons, including the terminally ill patients, including the differentially abled persons who are residing alone. They cannot cook food without the help of an aide. So the community kitchen has providing food to all these category of persons, and it is the volunteers who take the food from the kitchen to their house doors. For the poor persons, it is completely free, and those who are willing to pay a nominal amount of ₹20 has been collected from them. And this type of activity has been done during the COVID time. It continued when the flood happens. Most of the camps do not have a kitchen of their own. It has been fed from the community kitchen itself. So there is a lot of opportunities to the volunteers to perform their duty.
Yeah. Thank you so much. I think that was very nice of Kerala. I think this was specifically for Kerala, the categorization which you had mentioned of the
Yes,
food distribution. Yes, great, sir. To add to this, to add to what Anu sir had mentioned about this volunteers thing, I mean, with the backdrop of COVID. So when sir was saying that, at the panchayat office, these volunteers come and then they are kind of, given a certain duty. That is also the time, because COVID-19 or a COVID kind of a pandemic situation is new for everyone. That is also a time which you can utilize to sensitize them about their own safeties, as responders, as first responders, because there is a pandemic going on at the backdrop. This is not a usual scenario which will happen otherwise or in the past. So past may generally, we used to have individual disaster scenarios. But if it's a COVID situation, that is a time when you can talk to them, sensitize them, give them a bit of very, very minimal training as to what the initial, health, that hygiene, wearing of mask and all is required as volunteers also, and also train them a bit that when they go for, performing their activities and tasks, they can take care, they can guide the general people also for it. Okay, so like this can be done. So there's another question. One Mr. Pranabandhu ji has asked, why there was no preparation for outbreak of COVID-19? What pre-preparation could have been taken to prevent the spread at the initial stage itself? So do you consider it as a gap or something?
No, it is not a lapse. We should first understand what the characteristics of an epidemic like COVID. No country in the world has been successful in preventing the spread. What we can do is we can scientifically plan, or we can logically plan to contain the spread. We cannot totally avoid the spread. We can contain the spread. we have made a initial lockdown for some 2 months long lockdown. The PPE kits which we used in the forefront, it is not that common in India. For the matter, anywhere in the world. In Kerala, there was not a single factory producing the PPE kit in the month of January. So we have to prepare our equipments, we have to prepare our instruments and everything to fight such a pandemic. Number two, we cannot continue with a lockdown for 2 years. It will kill us. We have to resume our economic activity. So the most important thing is the self-discipline. Each and every person should take a responsibility of not getting infected. How? By actively following the SMS protocol, that is sanitization, mask usage, and social distancing. We should avoid crowding place. We should avoid crowding marketplaces. So the market has been opened in a phased manner. For initial 1 or 2 months, intermittent shops has been permitted, so that in a line of shops, first shop will be open, third shop will be open on a day, and next day the second shop and fourth shop will be open. So there we will get a space to the consumers to line up and get their things done. It should continue. I say that it should continue for a year or for some 10 months. But we know our human beings, we are very hesitant to follow such norms. In the family functions, we usually hug each other. We hug our niece or our uncle or auntie after 2 months or 1 year. It is not what we say promotable in a COVID-like situation. Do we change our characters? Do we change our way of living? It should be there. Otherwise, it is very difficult to contain such an epidemic, which is an airborne epidemic. We should avoid unnecessary travel. While traveling the public transport system, if it is a fully filled bus, we should not enter into. We should wait for the next bus. Do we? That is the question. So it's very easy to say that our preparedness is very poor, but it is that much Herculean task, given our density, given our basic infrastructure. We have done, I think, a very, very commendable work, not only in Kerala, in the entire nation. We have done a very commendable work. It is evident from our death rate also. So I cannot say that there was serious lapses, but there may be some lapses. I do accept it because we do not have any pre-knowledge about the extent of spread. We do not know what is the method of spreading and all.
Yeah, thank you, sir. Sir, we have 2 more questions. One is specifically for you, the other, either of you may like to answer. So one is about, how do you see the role of community, as a team, community participation in managing such disaster scenarios? And the other one is a bigger question. It's like, why do you see that, we lag behind in technology, or maybe it's basically about, developing various equipments. Like, we did not have PPE kits during the COVID-19. So, and we do not even have very well equipped hospitals. So why are we lagging behind? I mean, it's more general, I suppose.
Yeah, well, first of all, I will comment on the equipment part first. The PPE kit is not that commonly used thing. if you take the statistics of 2015, 16, 17, and 18, hardly some 20,000 or 50,000 PPE kits has been used throughout the nation. It is used only when we are doing a surgery of a HIV patient or a patient with a hepatitis B or C. Such type of exposures only the PPE kits has been used. Most of our medical fraternity or our health fraternity has not been trained to use the PPE kit also, the donning and doffing. It has been trained to them during the pandemic period, because we never came to such a situation where now today from our collectorate, I have seen the polling officials dressed up in PPE kits and going to the houses of COVID positive patients to get their vote cast. We are going to have the local elections, Panchayat elections in Kerala in a three-phased manner from December 8th, 10th and 12th. The local self-government elections are being conducted. So we have arranged polling facility for the COVID patients and those in home quarantine. The polling officials will go to their house, give them ballot paper. They will cast their vote inside their home and they will put it in the sealed cover, and it will be handed over back to the like the postal ballot that we issued to the polling officers, similar nature. So these officers who are never ever supposed to wear the PPE kits are wearing the kits and going to the home, not for treatment but for casting their votes for the local self-government. So we are using PPE kits in a very huge numbers. Now in our district also we have a production center, private production center is there. Government has set up 2-3 production centers throughout the state. Many cooperative societies, many cooperative factories has been started production PPE kits and all. So what we lack in the first phase was it was not used here. It was not used throughout the world. So the technology is very simple. It can be made from any of our lab. It does not have a satellite technology or something like that. The technology is very simple, but we do not use it. That's the thing. So we do not have a buffer stock. Now we are the exporter in all these things. After China, we are exporting all these things. So that is not an issue. We never foresee such a situation. That was the issue. And coming to the community participation, in Kerala, we do have a robust system of residents association. Some 100 houses, some 200 houses, there will be an association. And it will be an elected body among the residents. In multi-story apartments also, there is a management committee is there. So these are all independents, may be registered, may not be registered. So taking into confidence these office bearers, it will help a lot. While I was working in the district as the CEO DDMA, I usually do have a online meeting in every week with this residents association. There is a federation. It's pretty very. In Trivandrum, we have a federation of residents association in the district level. They have some 10 or 20 zones, and each zone there is a group of residents association. There, the elected representatives of the residents association will be in the zonal committees, and we usually interact with the district committees and the zonal committees, and we do arrange classes to the residents association office bearers. The medical college doctors will take the class, what are the etiquettes, what are the preventive measures that we should take. So we can disseminate information like anything. The online platform is there. So it is pretty easy to give a lecture to 100 or 250 persons who in a way trickle down it to the society. So that is a major area that we can intervene. Second one is the traders organization. We do have some 2-3 traders organization which have units in every villages. Kerala Vyapari Vyavasai Samadi, Kerala Vyapari Vyavasai Egovana Samadi, Vyapari Vyavasai Congress. All these things are there. So we in 2 weeks or some we will have a meeting, that too in an online platform with all these leaders of these organizations. We do have a very good labor organizations for the auto drivers, for the taxi drivers, bus drivers, all these head load workers. Then the SEVA is the self-employed women's organization, who is the major organization of the domestic workers. So while talking to them on a weekly or a fortnightly manner will help you in getting their confidence, in getting them to persuade their members to follow the protocols in a better way.
Thank you so much, Anu sir, for answering all these questions. It was a delight to have you with us. Over to you, Radna.
Thank you, ma'am. I would like to invite Mr. Amalraj sir for the closing remarks, sir.
Yeah, very good afternoon to all. And I think we are doing it in a good way. We had two speakers, both Naushaba and Anu sir. Both of them presented the key concepts very well, I think. So, and I think the interactions were also very much good. So I'm not going anything beyond it. So I would like to thank all people from NIDM, including the director and Sushma ma'am, for asking us to join the event, and thank you for providing the opportunity. And director ILDM is also watching the event because of that cyclone on today. We were declared as holiday, so none of us are there. Other people are here in the office. So director is watching the program, the live program. So I'm thanking him for providing the opportunity to us to conduct the program on this day.
Sir, if I may just interrupt, because you know you are amidst the cyclone thing, and we have a whole lot of participants. If the two of you can just share something about the current scenario around, you know, just what's happening around you all.
I think we were fully prepared for the last 2-3 days actually. All kinds of preparation like forces, public and wide publicity, everything we're doing in these days. So each and every persons were very much aware about the cyclone. So when it started up to Sri Lanka, we were it was leading to a track that of a previous cyclone which occurred on 2017 September 29th. It was named as Oki. So this present cyclone Burevi, its name is Burevi, the present cyclone. This was following the same path of the previous cyclone Oki. The previous cyclone Oki resulted the death of more than I think 150 fishermen people. So we were well prepared. We were well aware about the problems that can arise during this cyclone. So what happened that both the disaster management authority or the district administrations did their level best. Everybody is prepared. Everyone made their own independent communication system, even using ham radio people. They asked the fishermen people not to go to sea for the last 1 week, I think. And warning messages were issuing to each and every institutions. IMD was following each and every, I think some 2 hour or 3 hour messages were, bulletins were issued by IMD, and we all were watching that. And you know, we are right now, few people, those who are in disaster management, they are keen to know these things. So they were using the private apps, number of apps are there, like Windy. So they were following it also, and they were asking our remarks, what is going to happen, when it is going to hit, whether the time specified is this much, or in this time the rain will start, and will there be wind along with that. So all these questions were there. So in a way, and you know, the TV channel talks also were addressing all these things. Yesterday, many channels were asking with many experts, and they were giving their inputs, which means the people are getting aware. Anyway, the cyclone didn't make big issue. Just now, for the last 1 hour, it was raining heavily. That's all. No heavy wind. So right now we are somewhat safe, I would say. And if Anu sir want to add something, sir.
That's fine. That's good enough, sir. I just wanted a first-hand information, you know, for all the participants. It's something that's just happening around. Thank you so much, Amalji, and thank you so much, Anuji, and Noshaba ma'am also. Thank you for joining us. And over to you, Aradhna, for a formal vote of thanks.
Yes. Since we have come to the end of the webinar session, I will be addressing the vote of thanks on behalf of NIDM. Firstly, I would like to thank our Executive Director of NIDM, Major General Manoj Kumar Bindal, who have always guided and motivated us to conduct various programs. I would also like to thank Shri P.G. Thomas, IS retired Director of ILDM, for jointly organizing this webinar session with us. Then I would move ahead with the speakers. I would like to thank our speakers, Ms. Nosaba Nas and Mr. Anwar Nair, for the presentation, which was so in-depth, so detailed, and very well executed. So thank you to our speakers. And definitely, I would like to thank our coordinators of the session. We had with us Dr. Sushma Guleria, Assistant Professor from NIDM, and Sir Amal Raj. Because of them, this webinar has come to limelight. And definitely our participants who have been so patient with us and attended this entire webinar session. Before we end this webinar, I would just like to give 2 instructions. Firstly, the feedback link of this session will be mailed to all the participants, and e-certificate will be generated to those participants who have at least attended the webinar session for 90 minutes or more. So with this remark, shall I end the webinar?
Yes, Aradhna, and we thank Aradhna also for taking, you know, for all the background work and support. Just once again, to reiterate to all the participants, we shall be sharing the feedback, and definitely we have the copies of the PowerPoint presentations. Aradhna will be in touch with all of you for that. And please give us some time for issuing of the certificates, as you know, we work in rosters. So, you know, there's always a dearth of manpower at all given time during this situation. So it takes a while for us to distribute the certificates also. Thank you all. Thank you, Amalji, Anuji, Anashabaji, and all the participants. Have a good day. Be safe. Bye.
Thank you very much.
Thank you. Thank you, ma'am.
Bye. Bye. See you. Bye.